OK, let's get more on that story for you. Joining us here on the News Hour, Mehari Taddele Maru. He's a professor at the Migration Policy Centre at the European University Institute. He joins us live from Addis Ababa. Mehari Taddele Maru, isn't it just too soon for the authorities to ease restrictions in this way?
No, it's very early, actually. The transmission so far, based on the report from the African Union Center for Disease Control and Prevention, shows that most of the transmission until recent times are from international travels. Now we may see more of local transmission soon. And to stop that, countries has to continue the lockdown and the restriction and the aggressive physical distancing, which is very, very critical for the prevention of the spread of the virus.
I don't know if you've seen our report, but what struck me about the video contained within the report was this idea of, yes, officially they are trying to apply social distancing, but in our shots of marketplaces, busy marketplaces, there's zero social distancing taking place anyway.
Yes, I think it's a policy dilemma, because on the one hand, you want social distancing or physical distancing to prevent the spread and at the same time save lives. But saving lives in African context comes with sacrificing livelihoods, actually. And it's livelihood which is driving people to either ignore, to take the precautions of physical distancing, or at the same time they are trying to prioritize. African states do not have blank checks that they can issue to their citizens like elsewhere. And the only thing they can do is to persuade people to stay at home, use existing community assets, at least until there is sufficient preparations and understanding on how the prevention could be mitigated, actually.
What's the calculation on the part of the government here? I mean, why not leave it, say, another 2 to 4 weeks and do what other countries in Africa have done, which is directly approach the IMF and say, look, we need a bailout, we're good for the money, our economy was beginning to turn around anyway, but we will keep people at home, but we do need some liquidity into our market?
Well, those kind of requests and demand from African countries have already been met, and several studies have already shown that. I think some institutions have also pledged. But pledges take time, and they may not immediately be available because the countries themselves and institutions that are relying on those developed nations are in their own knee-jerk reaction to contain the spread of the virus. And that also is another dilemma that leads, actually, Africa has to fend for itself for a short time, at least. And then that only could be done through physical distancing and ensuring that there is aggressive prevention in the absence of ICUs and hospitalization and ventilators, where we don't have, actually, in African context. Even the most advanced ones, like South Africa, have a very limited capacity for hospitalization, ICU and ventilator. At last, they have to depend on community assets, and they have to march up the existing community assets for at least for the near term and short term.
What do you think this potentially might do to the local economy, given that the starting point for the economy, it was in a precarious state anyway, and now if they're going to ease these restrictions, the workforce goes back to work, and then potentially the workforce gets so sick, the workforce can't work?
Yes, I think if these lockdown restrictions are eased, there will be a spread of local transmission. That will be like a fire. And I think that is not something that is advisable. And many of the medical experts are saying that, epidemiologists are saying that. Now, so the dilemma presents itself in terms of the economy. I think the economy will be affected, first the health sector, and there will be a huge investment required for the health sector. And countries do not have that kind of amount of money. Like I said, the governments do not have blank checks to give. They themselves need blank checks, actually, from outside to invest on the health sector and in the economy. So it will be devastating in many ways. Countries will not be able to raise revenues, and that means it will affect all public sector and the delivery of the public service. And I think this is the reason why the priority should be on saving lives, and then think the next level on the impact of the economy, and how to mitigate the economic impact actually has to come at the second. So both the urgent and the long term, or the important, has to be dealt at the same time, but with some level of prioritization to the urgent actions, which is the social distancing, physical distancing that is happening now.
Mehari, Taddele, Maru, thank you so much.
Thank you.